Ladies and gentlemen, receive my greetings from Kenya. My name is Reggie Ann Jaji. I work with Islamic Relief. Currently, I'm based in South Sudan as a health and nutrition manager. Initially, I was working with Islamic Relief Kenya. I was based in Dadaab refugee camp as a health and nutrition coordinator. Now, the subject of this presentation is related to the field guideline. It's related to the field test that I did on the faith-sensitive approach guideline for mental health and psychosocial support. That has been developed by Islamic Relief and other partners, including LWF. Islamic Relief Kenya was one of the international non-governmental organizations that was supporting refugee programs in Dadaab, in Ifo camp, more so in health and nutrition component. Now, during our field tests related to the faith-sensitive approach program in the humanitarian responses, we were able to do a field test on the guideline in our existing health project that was being implemented in Ifo camp and the Dadaab refugee complex. And this was one of the thematic areas that appears in the guideline that has been developed. Mine is to provide or is to share with you an experience on the field test of the guideline that was done in our health project in the Dadaab refugee complex, more so related to the area of establishing reliable mechanism to relevant faith actors in the provision of psychosocial support and spiritual care, and also engaging the faith leaders to shift norms that maintained harmful practices. Now, during our field test, most unique thing that we did is that the field test was integrated in our existing programming in health. Islamic Relief had a mental health clinics for the mental health and psychosocial challenged patients who could seek interventions in the facility. Now, that was an entry point for the field test of the guideline, whereby we were able to identify the commonly used religious leaders who are 6 in number during the visits of the facility by the patient, of which we conducted some interview to identify the common used religious leaders by the community to seek intervention for their spiritual and psychosocial care, not related to conventional medicine. This was very successful. During our interview with the clients, we were able to identify these leaders, and after that we were able to hold some series of focus group discussion and community dialogue on our peripheral facilities, which are primary health care units. Now, in these areas, we hold focus group discussion and community dialogue, whereby we had a discussion with the community members that were invited, and also the 6 identified religious leaders who could chair together the community, who could chair the meetings and the dialogue together with Islamic Relief staff in order to identify the harmful practices that were taking place at the community level for the mentally health and psychosocially challenged clients. And some of the unique things that we are able to pick during our field test, of which some of us we are not aware of, were like chaining of the mentally health challenged patient, association of the mentally health or psychosocially challenged people with evil spirit, the neglect of these patients, and whereby when some of the community members are seeking religious intervention, at that moment they could not be able to access the services because of the fees that were charges for the sessions of Quran. So those are some of the unique experiences that were taking place at the community, and you are able to hear them during the community dialogue and focus group discussion. And this appears so well on the page 56 and page 57 of the document that is in discussion, of which resolution came out from the discussion to ensure that people shift from these harmful practices and the norms that were not right, And even it gave an upper hand for the religious people to sell their services in regards to access to spiritual care. Now, this case, that some of the clients that were seeking spiritual intervention, like the Quran prayers, was related to the belief that mental health is associated with evil spirit. And as much as the clients were seeking conventional medicine or conventional treatment, they were not satisfied with the services alone. They had to go for these spiritual care and psychosocial support to religious leaders and faith people at the community level. Another field test that was done by Islamic Relief Kenya was in our program in Wajir, whereby using religious network to identify vulnerable individual household in order for them to access food support. Now, this was under the thematic area of food security and nutrition, whereby Islamic Relief used the religious leaders to identify the beneficiary and did the registration for the beneficiary, more so the vulnerable community. And at the end of the day, we were able to provide food support to these people that were identified by the religious leaders using the network that was existing in place in Wajir County. And people access services without any conflict, without any interruption, because one unique thing that came out clearly is that any registration that was done by the religious leaders, that is the sheikhs, under their networks, nobody had disagreement with them, because it was faith, that they are very sincere, and whatever they were doing was very right to the community. In conclusion, based on the field sensitive approach on the field test that we did in Kenya, that is the refugee programming, and even in our program in Wajir County, I want to say that taking people's faith identity seriously is very important, because you realize in the mental health clinic, despite of us providing conventional medicine to the people, the informant and some of the clients who have insight of themselves was seeking religious or spiritual care for them to have comfort and cure in the treatment that they're being provided. And at the same time, we are also able to identify harmful practices that are taking place at the community of which you are not aware of it. And some of these harmful practices, you are able to come out with resolutions on how to solve them and how to help the community to shift from this social norm. So what I want to say clearly, first of all, the guideline was implementable in our field test. It is something that it was workable and easy, because we integrated it in the thematic area of the existing programming that we had in the mental health and psychosocial support. And if you look at even in the Interagency Steering Committee guideline for mental health and psychosocial support, the thematic area still existed there. And for us, it was very easy to implement the guideline and to integrate it and come up with case studies and examples that have been reflected in the guideline that has been developed precisely in page 56, 57, and even page 72 and 73 of the document. Thank you so much for listening to me, and I believe that taking people's faith identity seriously is very important, even in our implementation of our routine projects, apart from the mental health and psychosocial support programming.